Okay, class. In this video, we are going to introduce the tongue diagnosis. The tongue diagnosis is one of the most special diagnostic methods in Chinese medicine. It is a part of the inspection, but due to the fact that there's a lot of information in tongue diagnosis, so we use a separate session to talk about the tongue inspection specifically. Practitioners, the Chinese medicine practitioners, focus on the tongue diagnosis since 黄帝内经. So since the four classic, in 黄帝内经, it described that patients suffer from lung heat. So there's heat. There is heat in the lung. The patient will feel aversion to cold, or will feel chills, aversion to cold, and the tongue will present with yellow color. So that's the one of the example from 黄帝内经. And for these thousands of years, the tongue diagnostic methods keep developing. And today we're not going to talk about we are not going to talk a lot about the history. We're going to focus on the clinical indications. And also for these a few videos, we're going to introduce how to observe the tongue. What's the indications from these signs? So for this session, we're going to focus on three parts. The general introduction, give you a brief background of the tongue, and also we're going to talk about the tongue body and tongue coating. Firstly, the tongue inspection. We need to understand, we need to learn about the anatomy and physiological functions of the tongue. And same as the other session of the information from acupuncture or for Chinese medicine, we do introduce the anatomy, but we do not focus on the anatomy a lot. So for the detailed information, especially for this session, you can refer to the other disciplines in your general medicine, especially for the study on tissues. So here we give you a very brief introduction of the tongue anatomy. As you can see the tongue here, this is a drawing. Because from the drawing we can see more clear. We're going to show you the tongue, but when you see the tongue, you will see it's not that obvious. So from the tongue, firstly, when you see the tongue, we're going to separate the tongue in different areas. The tongue body and the tongue root. Where is the tongue body? Where is the tongue root? The anterior oral part is called the tongue body. Where it is? So this part. The line here, that's the use as a line. This line. This is shape. Anterior, this part we call the tongue body. Posterior, towards the line, we call it the tongue root. So that's a very brief division of the tongue structure. And what's on these structure, or what's on these tongues is firstly is filiform papilla. There are many different papillae on the tongue, which forms as you can see in the picture, these little stuff. And from these different papillae, the mixture of the papillae, and the saliva and the food will form a coating on top of the tongue. That's the tongue coating we refer to. So these are different papillae on the tongue, and this It's part of the fat that contributes to the coating. So for the tongue inspection, what do we inspect, or which parts we are focusing on? Firstly, the manifestation of the tongue. That's something we inspect. We're going to focus on the tongue body and the coating. The tongue body refers to the muscular structure of the tongue and the sublingual veins. So that's the muscular, as you can see the picture here, the muscular structure of the tongue. Sub, sublingual veins, the veins underneath the tongue, these two, is also we're going to inspect. Apart from the tongue body, we're also going to observe the coating. The coating refers to that covers the surface of the tongue. So as you can see from this picture, the stuff on top of the tongue, that's the coating. So for the tongue inspection, we focus on these 2 or 3 aspects, especially the muscular structure from this part and this part. We do also observe the sublingual veins. That's only, frankly speaking, we only observe in some conditions. So we don't really observe in every person. But from the first picture, the muscular structure and the coating, we will observe in all patients. And why from the tongue inspection we can tell the situation of the body. If you go to the next, how does the tongue link to the 脏腑 organs? Firstly, the tongue links with different organs through the meridians. From the meridian and cholesterol we introduce in the basic theory, and in future, in the second years, we're going to study the acupuncture and moxibucture in details. We're going to study the meridians one by one. And from the study there, you will understand that there are many meridians, many branches of the meridians link to the tongue. So that's the direct connection from different organs to the tongue. Apart from the direct connection to the tongue with the organs, also the manifestations, the functions of the tongue are related to the qi, blood, the body fluids, such as the color appear on the tongue. Where does the red or the pink color come from? That's from the blood. So that's the color of the blood, and the blood is related to the heart function, the liver function, the spleen function, right? So these are all the theories that we introduced in basic theory. The heart governs the blood, governs the vessels. The blood comes from the middle jaw, which is part of the acquired qi, and the liver stored the blood. So that's the different in terms of the tissues of the substance of human body. The tongue and the internal organs also links in this type in this field. So firstly is from the meridian with the direct connection. The second is the tongue linked with the internal organs through the function of qi, blood, and body fluid. So here just a brief drawing of the tongue. We're going to separate the tongue in different locations. anterior, we call the tongue tip. In the middle, the center, and the root. So the roots is area, including at the back. And also we're going to separate the tongue. So we're going to divide the tongue in 3 sections: front, middle, and back. The tip, the center, and the root. So we're going to divide in the other way. So that's the sides on both sides. So that's the something you need to remember when we describe the tongue. We're going to use these locations. You can talk the tip is red, or the side is red. The center, when we talk about the tongue center, where do we refer? That's this area, and the root, this area. So that's how we describe the location of the tongue. The content of the inspection, that's the information that we focus on in these few videos. All what we focus on is the tongue body and the coating. The tongue body include vitality, also because tongue spirit. So when we talk about the inspection in the facial complexion, we also talk about the spirit. Now we also talk about the spirit, the tongue color, the shape, motility, sublingual veins, and coating, the texture of the coating and the colors of the coating. So that's all the aspects that we're going to discuss. We're going to introduce one by one. The tongue inspection become very important in our study. It is because we can gather a lot of information from tongue inspection. It is also because in Africa, that's when we see patients, there's some of other diagnostic methods that we cannot perform, or we cannot perform well, such as the facial complexion. Because of the different races, we got different skin colors. So sometimes it's not easy for us to distinguish from facial complexions, but from tongue inspection, that's we can see. So this become very important. Doesn't matter what kinds of races, the white, the black, the colored, the Asian, we all can observe from the tongue. So on the left side, still another image of the tongue structure, the tip, the middle of the tongue, at the root of the tongue, and edge. And this location also linked to different parts of the organs. The reason why it linked like this, the tip, when we separate the area in 3 areas, you should think about in 脏腑 organs, which theory that we also separate into 3 levels. That's from 三焦 theories. Upper jaw, middle jaw, and lower jaw. Upper jaw, middle jaw, and lower jaw, right? We're going to separate the human body into 3 locations. Here, the tongue also imitates to those areas. The upper jaw is where the heart and the lungs sits. The middle jaw is the spleen and stomach. The lower jaw is the kidney. On the sides, on the edge of the tongue, it refers to the liver and gallbladder. The reason is because the liver and gallbladder meridian also travel on the sides of our human body. So that's the general distribution or general connection with the internal organs and the location of the tongue. In this slide, we're going to talk about the methods and the cautions of the tongue inspection. In other words, we're going to talk about how to perform the tongue inspection and what needs to be taken in consideration when performing tongue inspection. So firstly, how do we perform the tongue diagnosis, the tongue inspection? In the tongue inspection, the patient will be in seated position or in lying position. The reason is because during the inspection, we will prefer that the practitioner's eyesight is slightly higher than the patient's tongue. So, such as in this picture, in most conditions, we will sit at the opposite side of the patient, or the patient can sit in this corner. So that's the 90-degree side from the practitioner. In this situation, the practitioner's eye, when we observe the tongue, will be in this direction, will be in from higher direction to observe the lower position. That's one. This is the preferable position from a higher parts to observe lower parts. This can help us to observe better. The second is from the patient's pulse. When we perform the inspection, we will ask the patient to put their tongue out, similar to the pictures on the right side, or this picture is similar. We will ask the patient to put the tongue out and relax. In this situation, we need to be careful that we need to instruct the patient to put the tongue out and relax. As you can see from these two images, this one and this one, these four images. If the patient put the tongue out and puts some force on the tongue, it will change the information we can gather from the tongue. Let's see from the first two from here. The same patient at the same time, when they put the tongue out, if they put a force on the tongue, this one is more relaxed. You will see the blue parts here is not that obvious in this tongue. And also from the tongue on the right side, we can see the marks on the side here. 1, 2, 3. But from this image, we don't see that clear. So if the patient doesn't put the tongue out properly, we will mix some information. That's why it's very important to instruct the patient to put the tongue out and relax. That's why it's overstretched. Also, not a good position. We're going to introduce what we're going to focus on what these marks means in the future videos. But here, just give you an example that if the tongue is not placed well, it will affect the signs that we can gather from the patient. And also, apart from the position of the practitioners and the patients, how to put the tongue out. Also, we need to be careful that in one inspection, in one observation, we do not ask the patient to put the tongue out for a long period. The reason is if you ask the patient to put the tongue out for a long period, the color may be changed. The circulation of the tongue also may be changed. So sometimes you will gather the false information if the patient put the tongue out for long. Also, from the other side, the patient also don't feel comfortable if they put their tongue out for too long period. So if you are not sure about one signs or you want to confirm about the tongue, rather ask the patient to put the tongue out again to perform a second observation, a second inspection, rather than observe for a longer period. The next is how to perform, or what are we going to see from the tongue. So we're going to see from the tips, the order, we're going to see from the tip of the tongue, we're going to see the middle of the tongue, we're going to see at the roots of the tongue, and then followed by the sides of the tongue. That's how we observe the tongue. We're going to focus on the muscular structure, the colors of the tongue. We're also going to focus on the coating on top of these areas. So in this order, from the tip, middle, to the root, and then to both sides. According to this order, we will not mix any parts of the tongue. So this is how to perform the inspection. Also, the cautionary notes will need to be taken into considerations. This is very similar to the facial complexion inspection. The first one is the light. As you can see here, I give you two images. That's from one kid. As you can see, the tongue is from the kids. At the same time, with different lights, you will see the color changes. So with a darker color, with a brighter light, you can see the color of the tongue changes. So the lights you need to take into consideration. Preferably, same as the facial complexion, we prefer to observe the tongue under a natural light, and the light should not shine on the tongue directly. So don't observe the tongue under the sun while the sun shines on the tongue. Apart from the lights, the food or medicine also need to be asked in some situations, because some food, such as milk, coconut milk, soya beans milk, and after drinking this milk, the tongue color, especially from the coating, sometimes can change. Or someone drink black coffee. After they drink black coffee, when you see the tongue, they also may be changed. Some of the tongue color also can be affected by some medicine, especially for some medicine if the patient take for quite a long time, such as if they taking antibiotics for a long period. The antibiotics also going to change the environment in the body, going to change the situation. The patient can present with different tongue coating, with either different color or different property of the coating. The oral health, this part also need to be taken into consideration. So, for instance, if the patient suffer from dental problem, or if they have their mouth open while sleeping, the patient will feel dry mouth in the morning. When you observe the tongue, the coating on top of the tongue also can be dry. Also, if some patient, if they don't have teeth, if they remove all of the teeth, then it is not easy to see these marks. These we call teeth mark. In the future slides, we're going to introduce in details. If the patient without teeth, sometimes it's not easy to see these. So that's something you need to think about when perform tongue inspection. This is the color from the light. In the next slides, we're going to show you some images, such as the first picture. You can see the patient has thick coating from the middle to the back of the tongue, but also you can have a look here. The slightly yellow. What happened to this? When you see this kind of color, you need to confirm with the patient. Have they taken some medicine, or have they eaten some food with the color dyeing the coating. On the second image, firstly, from the second image, the light is not ideal, so it's too bright. When this kind of light is shining on the tongue color changes. Also, this patient, the tongue is not in a relaxed position, so the tongue is overextended. From the third and the fourth picture, this is from one patient. As you can see, when this patient relaxes, you see the tongue shape changes. Also from the teeth mark, you see from this tongue, you can see on the side there's something here. But from the third image, you don't see that clear. For the teeth mark from this image, you don't see that clear. So that's why the position, how the patient put their tongue out, is very important. Put the tongue out and relax. Don't stretch or overextend it. And from the tongue inspection, we can see the 脏腑 organs. The reason is because the tongue is related to the heart, related to the spleen. We have introduced from the connection with the 脏腑 organs. So that's why it is very important for the tongue inspection. In order to understand the abnormal tongue appearance, we need to learn about the normal manifestation. So this is very similar to the facial complexion. In order to pick up the abnormal aspects, you need to know what's normal. So what's a normal tongue manifestations? In a very brief words, like red tongue. So the tongue is red, but not too red, light red or pale red, with a thin white coating. This is only from the muscular structure and the coating. The tongue also need to be moist and flexible, or the movement of the tongue should be smooth. So that's a healthy tongue, a normal manifestation. Moist, flexible, light red, and thin white coating. And what's most important is the color and the coating, light red and thin white coating. What's the light red or thin white coating? Here I give you two images. The first one, the color of this tongue is good. So this is a normal tongue color, light red or pink. So this color we call the light red. Compared with the one on the right side, the color is pale. The why I put two images here is because the coating on this tongue is normal compared with the left side. The reason is at the roots, you can see here, there's something thicker, so this patient is not healthy. If you only see the coating from the front part, so you only see the coating, this part of the tongue, this is a very healthy tongue. So a healthy tongue, you can see this section without the roots, or you can have a combination of these two pictures. This color and this coating, when they combine together, is considered as the normal manifestations. The tongue manifestations also will be affected by the age, body constitution, and in seasons or the climates, the gender. From the age, such as the senior person, senior people, they always weaker in terms of qi, in terms especially the antipathogenic qi. So they are weaker, the circulation is also weaker, so the tongue can present dark red, which indicates the poor circulation. For kids, The tongue may present with like tendon. The tongue manifestation with gender, male or female, this is quite similar, but for female, in the period cycle, the tongue manifestation also may change a little bit according to the cycle. The body constitution, the body constitution will affect the tongue manifestation, such as the patient with the cold constitution. The tongue may present with pale color. A patient with excess heat in the body, the tongue will be red. The season also can affect the tongue. The reason is because the climate in different seasons will be changed, such as in summer. When it rains a lot, especially in Joburg, in summer it rains a lot because the humid climate in the environment. This humid climate will affect our organs and cause dampness in the body. When we have excess dampness in the body, we also can see from the tongue, such as the watery or greasy coating. So the tongue manifestation also can be affected by the seasons, but these changes is considered as physiological changes. So the small changes according to the age, body constitution, seasons is not considered as the pathological conditions. So in this video, we introduce the general introduction of the tongue inspection, how to perform the tongue inspection, what needs to be observed from the inspection. In the next video, we're going to go through the details of the signs on the tongue.